Anatomy of the heart. The heart is a hollow muscular organ which pumps blood in all large vessels in the body. What is the position of the heart? First of all, we should know what is the mediastinum and what is the middle mediastinum. Mediastinum is the mass of tissues between the two pleural sac. Massive tissue between right pleura and left pleura which cover the right and left lung. The tissues between the right and left pleural sac is called mediastinum. The tissues here in between the right and the left pleural sac which covers the lungs called the mediastinum. The mediastinum is divided into superior mediastinum and the inferior mediastinum. The inferior mediastinum is divided by the pericardium. The pericardium, which is a sac covering and surrounding the heart. By the pericardium, which include the heart inside, the inferior mediastinum is divided into anterior mediastinum, anterior to the pericardium, and posterior mediastinum, posterior to the pericardium, and the middle mediastinum, which include the pericardium and the heart inside. Therefore, first of all, the site and the position of the heart is inside the pericardium and in the middle mediastinum. This is the heart, and this bone is called sternum. The heart lies behind the body of the sternum and related from second to sixth costal cartilage. The heart behind the body of the sternum and from second to sixth costal cartilage. About 1/3 of the heart, 1/3 of the heart only, lies on the right side of the middle line, while 2/3 of the heart lies to the left side of the middle line. What is the size and weight of the heart? The heart is slightly larger than the closed fist, with average weight of about 250 gram to 300 gram. In the living, we can detect the dimensions of the heart by this clinical examination, which is called percussion, and by investigation like echocardiography. Echocardiography means ultrasound on the heart. The heart is divided into 4 chambers: 2 atria, right and left atria, and 2 ventricles, right and left ventricles. What is the shape of the heart? The shape of the heart like this. What is this? Conical in shape. Conical in shape. And this structure, which is conical in shape, has a base or posterior surface and has apex. And the axis of the heart is imaginary line extending from the base posteriorly to the apex anteriorly. And this apex from the base to the apex, this is the position of the heart. The base posterior surface and the apex is directed anterior and to the left. And the apex from the base to the apex is directed downward, forward, and to the left. This axis directed downwards, forwards, and to the left. The heart, beside the base and the apex, has two surfaces. Anterior surface, or called sternocostal surface, because this anterior surface is related to the sternum and the costal cartilage. Therefore, it is anterior surface or sternocostal surface. And this surface from below, this surface from below is inferior surface, or it is related to the diaphragm. Therefore, it is called inferior surface or diaphragmatic surface. The heart has four borders: superior border, inferior border, right border, and the left border. First of all, let us discuss the external features of the heart, starting with the base and the apex. First of all, this is another view for the human heart, representing a conical, which has base, apex, has anterior surface, which is below in yellow in color, and from below inferior surface, and has four borders: superior border, inferior border, right border, and the left border. First of all, we will start with the base of the heart. The base of the heart is also called the posterior surface of the heart, because the base is directed posteriorly. The base, which is the posterior surface of the heart, is directed in this position. What is this position? Directed backward and to the right. In contrast to the apex, which is directed downward and to the left. Look for this position, the base, which is from behind, can be seen from behind, is directed upward and to the right. In contrast to the apex, which is directed downward, forward, and to the left. The base of the heart is formed of the two atria. The base of the heart, this is the base of the heart seen from behind. The base of the heart, which is the posterior surface, better seen from behind, is formed of left atrium and right atrium. Therefore, the base is formed by the two atria, but mainly right atrium or left atrium. The base of the heart is formed mainly of left atrium. What are the features of the base of the heart or the posterior surface? First of all, these two veins coming from the lungs, carrying oxygenated blood from the lungs. These veins are called pulmonary veins. Pulmonary veins carrying oxygenated blood. Why they are called the veins? Any vein coming to drain into the heart should be called the vein, and any vessel coming from the heart to the other parts of the body should be called artery, irrespective to oxygenated or deoxygenated blood, because these vessels draining the lungs and pass to drain into the left atrium, therefore they should call the veins, because they bring blood from other part of the body to the heart. In contrast, to example, to this artery, which is called the pulmonary artery, which is carrying deoxygenated blood to the lungs, but containing deoxygenated blood, but it arises from the heart to other part of the body, it should be called the artery, irrespective to the type of blood. Although it containing deoxygenated blood, but it's called the artery because it arises from the heart. Along the upper border of the heart, which lies above the posterior surface, this is the posterior surface or base, which is limited, the base is limited above by the upper border, and the upper border of the heart passing these arteries, which are right and left pulmonary arteries, run along the upper border, and below the base or the posterior surface is limited by this groove or sulcus. This groove or sulcus surrounds the heart like a crown. Therefore, this sulcus is called coronary sulcus. And the coronary sulcus containing this vein, which is called coronary sinus, and containing the artery called circumflex artery. Therefore, the posterior surface have an upper border, and along the upper border runs the pulmonary arteries, right and left pulmonary arteries, and the lower border of the posterior surface or the base is the coronary sulcus, which containing coronary sinus, this vein, and associated artery called circumflex artery. On the right side of the base, what is this? This is the right atrium. And in the right atrium, open the superior vena cava and the inferior vena cava. The superior vena cava and the inferior vena cava open in the upper end and in the lower end of the right atrium. The base of the heart is related posteriorly to what? Related posteriorly to this. Here, posteriorly is the base of the heart. Related to what? Related to thoracic vertebrae. Middle four thoracic vertebrae. The middle four thoracic vertebrae, thoracic vertebra number 5, 6, 7, and 8. But the base of the heart is separated from these vertebrae by structures. The following structures from anterior to posterior separate the base of the heart from the middle four vertebrae. First of all, behind, this is the shape of the heart and position of the heart inside the pericardium. And if we remove the heart, in this picture, we remove the heart to see what is the structures related posterior to the heart and posterior to the base of the heart. Posterior to the base of the heart, when we cut the heart, we will find this. What is this? This is the pericardium. And if you introduce your hand below the apex, below the diaphragmatic surface, to reach by your hand behind the heart, you will meet a potential space, which is a part of the pericardium, called oblique sinus of the pericardium. Oblique sinus of the pericardium. We will discuss the pericardium in full details later on, and we will know that the pericardium is formed of serous part and the fibrous part. And here we cut the fibrous part and we introduce your hand behind the heart in the serous pericardium. We will find this potential space, which is called oblique sinus of the pericardium. Behind this sinus, there is fibrous pericardium. Therefore, the first relation just posterior to the base of the heart is serous pericardium and the fibrous pericardium. And the serous pericardium here forms this potential space behind the heart, which is called oblique sinus of the pericardium. Posterior to the heart, these two structures, two from left and two from right, passing to drain into the left atrium. Two left pulmonary veins and two right pulmonary veins. And we said before, the name only is vein, but they contain oxygenated blood, drain oxygenated blood from the lungs to the left atrium. Posterior to these two structures is there is a vein on the posterior aspect, fine vein, very small fine vein, passing obliquely on the left atrium, called oblique vein of the left atrium. and the base is related posterior to this oblique vein of left atrium, which passing to drain into this vein, which is called coronary sinus. Finally, if we remove all these structures, we remove the posterior pericardium and oblique sinus and remove the pulmonary veins, you will find this picture. What is this picture? Posterior to the pericardium, there is part of mediastinum called the posterior mediastinum. And the posterior mediastinum containing four main structures separating the pericardium and the base of the heart anteriorly from the vertebrae posteriorly. These four structures are two large tubes descending thoracic aorta and esophagus, and two small tubes, vein called the azygous vein, and the lymph duct, which is the main lymph duct all over the body, which is called the thoracic duct. This is another view after removal of the heart and the pericardium. After removal of the heart and the pericardium, we can see here the structures in the posterior mediastinum. This red color is thoracic aorta, descending aorta. This muscular structure, esophagus. This vein is azygous vein. This fine duct is the thoracic duct, which is lymph duct. And along the upper border of the base, passing these arteries, right and the left pulmonary artery. Okay. And in this picture, this is a deep dissection of thorax. Deep dissection of thorax with removal of the heart and the pericardium to see the structures related to the base of the heart. After we take the base of the heart, we should discuss the apex of the heart. What is, before we take the apex, this is a very perfect view for the base of the heart and the posterior mediastinum from behind. We remove the vertebral column, the middle four thoracic vertebrae, and we see from behind, we see the aorta, esophagus, and in front of this structure is the pericardium and the base of the heart. The apex of the heart. This is the apex of the heart seen from behind. This is the base directed upward and to the right, while the apex is directed downward, forward, and to the left. This is the heart. The base is directed upward and to the right, while the apex is directed downward and to the left. The apex of the heart is the lowermost and the leftmost point of the heart. This is the apex of the heart, the lowest and the most left point in the heart is called the apex of the heart. It is formed of, this is chamber only, formed of left ventricle only. What is the surface anatomy of the apex of the heart, which is very important to examine the heart? During examination of the heart, the doctor put his hand to feel the apex of the heart. Where? On the left side of the middle line or on the right side of the middle line? We said before that 2/3 of the heart is towards the left side. Therefore, the doctor put his or her head to the left side in the left fifth intercostal space. Left fifth intercostal space. Just medial to a line drawn from the middle of the clavicle, called the left mid-clavicular line. Left mid-clavicular line. About 9 centimeter from the median plane. This is the position of the apex of the heart in intact thorax here, where left fifth intercostal space, just medial to the left mid-clavicular line drawn from the middle of the clavicle, 9 centimeters from the median plane. Left fifth intercostal space, just medial to the left mid-clavicular line, 9 centimeter or 3.5 inches from the middle line. What is the relation of the apex of the heart? The relation of the apex of the heart is what? Related to the left lung, and the left lung is covered by a serous sac called the pleura. Therefore, the apex which lies to the left side related to the left lung and the left pleura. This is another, the apex here related to this left lung, and this white color is representing the left pleura, which is retracted to see the apex of the heart. If you leave this lung and the pleura, it will cover the apex of the heart and comes in contact with the apex of the heart. The left pleura and lung are retracted to see the apex. This is the apex and base of the heart. We will complete in the next video. Thank you for good listening and good luck.